So why should we be treating blood pressure? Well, the main reason is, of course, it's a huge problem in general practice, a major cause of stroke, MI, dementia, renal failure, and it is very, very common. Around about 30% of adults in Scotland have it. But in terms of your workload, in Scotland, there were 1.2 million appointments taken up by this for nothing else but checking blood pressure when it was last measured. A massive number of appointments. And this is getting worse because the population is getting older and have conditions which require their blood pressure to be measured. Well, we chose telemonitoring because of the research behind it. Both research in Scotland, in England, and all around the world has demonstrated that if you use telemonitoring to manage blood pressure, that the blood pressure is reduced on average by around about 3 to 4 millimeters of mercury, which may not sound like much, but that would reduce the stroke rate by 15% and the MI rate by 10%, a massive reduction. However, a lot of people will say, well, you can make these things work in trials, but can you make it work in real life? And the answer is yes. Again, work we did here in Scotland, where telemonitoring was just included in normal practice, in normal care, in routine practices, we were able to show that the same sort of blood pressure reductions occurred there as they did in the randomized controlled trials. But the interesting thing was that not only did it lower blood pressure, but it actually reduced the number of appointments that patients took with their GPs and nurses. We had a reduction in the region of 25% in face-to-face consultations, and that is all face-to-face consultations, not just those for blood pressure. So a big reduction in face-to-face and a smaller reduction in all other appointments. So although these weren't randomized controlled trials, very, very strongly suggestive that this certainly does not increase workload, but that it does improve outcomes for patients. So something that's really well worth doing. It's been very, very popular with doctors and nurses, and particularly in some parts of Scotland where we started it earlier, in Lothian and Lanarkshire, for example. In some practices in Lothian, almost 1,000 patients are being managed in this way. And as you can imagine, there are very few doctors and nurses who would continue to use a system like this if it was creating work for them. They're very enthusiastic about it. Patients love it. All the feedback we get back from patients is that they find it helpful. We have some very elderly patients using it. Some use their relatives and friends to help them with these devices, but most of them can manage it perfectly well. The oldest person we had using this in Lothian was 95. We now have a national remote monitoring solution, which is an excellent solution for this because it provides a patient with a variety of ways of sending in their data. They can use an app, text, they can go online on their computer, or they can use touch-tone telephone with pre-recorded messages. So it's open to just about every type of patient. It's highly configurable. It links to Docman and also has the potential to link to Sky Store so that colleagues in hospital are able to see reports as well. So what does Scale Up actually offer? Well, it offers a variety of protocols for people at different levels. So in terms of whether you want people very well controlled, for example, after a stroke, or a routine level of control, but we offer a variety of protocols with different ranges on this. So for example, for diagnosis or medication titration, a transition period to long-term monitoring and long-term monitoring. And in each of these, what happens is that patients are asked to measure their blood pressure on a variety of number of occasions, depending on how well controlled they are. And the clinicians can ask for reports from this system which comes via DocMan just in your routine mail, along with your blood result and hospital letters. And it comes in at a frequency that you want. So if you want a report every month, you can have it, or a report every 6 months, you can have that too. And a lot of people are on 6 monthly reports who are well controlled. The system is geared up so you're not inundated with reports on a single day. It's very, very clear, the report. It makes it obvious if someone is not well controlled, and it makes it clear that you should perhaps consider whether the patient is regularly taking their medication, or whether, in fact, they may need to increase or possibly reduce, if the blood pressures are lower, their medication. I find it very helpful indeed. Instead of just having a single blood pressure in a patient who may be anxious, who may have had to wait for a considerable length of time before seeing you, or have just been upset by something in their lives, you have a whole series of blood pressures taken at different times of the day often. And so a much better idea of the pattern of blood pressure of your individual patient. That has two functions. Not only does it let you know how their blood pressure varies quite a bit through the day, but it also convinces the patients and convinces the doctors that this patient really does have a blood pressure problem. When you've got 20 to 30 blood pressures, it's very, very difficult to say it's because the bus was late, or it's because I had a row with my daughter. These multiple blood pressures are extremely helpful, both in making a diagnosis and in persuading patients that their therapy needs to change.